Well, good afternoon, everyone. I hope you're doing well and wherever you are, have a nice weather. Just like the do outside this door here on the screen. This is the kickoff, a reboot of what's called Thriving Thursdays, which is a free community webinar. You don't have to be a patient to attend. Um, Thank you for attending live if you're attending live, and if you're watching this on a recording, thank you for listening to the recording. You can also put in the chat on the social media if you're listening to this, if you have any questions about what functional medicine is or, how you could actually practically use this. So we're going to be diving in today to addressing chronic disease through something called functional medicine, which is basically a introduction to this using a root cause principles of biology to resolve issues so that people will get well and stay well. And this is the promise of functional medicine. So this is a reboot of free webinar series, and we're so glad that you're here. Medicine always begins, and I like this slide because medicine begins with food, and using food as medicine, food to change your biology, to reduce inflammation, to improve circulation, to help with brain health, to help with gut health, feeding your microbiome, ensuring healthy bacteria. Sometimes we use medicine, that's where the stethoscope comes in. We'll use supplements, but it's really a combination of natural and lifestyle medicine, integrative medicine. Um, there are ways to kind of integrate the natural approach with a medical approach, and that's what we do here. And that's, I think, the best way to treat someone, whatever condition you have or whatever you're trying to do in terms of your health goals, is really using food and lifestyle and other natural means, and then medications when needed. So, in the beginning, I just want to talk about kind of the problems that we have in the United States. That this is a few years old, but this is total healthcare costs as percentage of gross domestic product. And essentially, this shows that the United States spends much more on healthcare than other nations, despite us, I think, being ranked number 48 or 50 or something like that in actual healthcare quality, in terms of performance of, can we what's our life expectancy like? What's our health outcomes like? We spend the most, but we're like ranked number 50. So we know we have a lot of, improvement to make here as a country. The US, we're among wealthy countries, which includes some of these countries here listed, ranks last among these 11 nations. This was a study done by the Commonwealth Fund on things like healthcare quality, access, efficiency, and equity, as well as indicators of healthy lives, such as infant mortality. We ranked last, below some of our neighbors. And when you look at chronic disease and basically advocating for overall population health, I feel like it's really good to quote Albert Einstein, and he probably said this in different angles. Basically, insanity is doing the same thing over and over again, but expecting different results. So we need a different approach if we want a different result to our healthcare system and to our health in general. So we can't keep on eating McDonald's or, fast food and expecting us to lose weight or reduce cardiovascular disease, reduce cancer, dementia, chronic illness, chronic skin issues. We can't keep on doing the same things that are making us sick. And we can't keep doing those same things because those same kids are going to grow up 30, 40 years later or more and need open heart surgery, need a lot of expensive surgeries that are life-saving. And it's good that we have this technology, but it's better to prevent it if we can. A lot of people think, well, there's some chronic illnesses going on and there's some, issues in the family tree, and, my DNA is just my destiny. But that's just not true. Our DNA is not our destiny because genetics have some role to play for sure in terms of health, but 90% of gene activity is modifiable through lifestyle measures, things like healthy nutrition, activity, stress management. We can use medications, we can use, pharmaceuticals, nutraceuticals. Different things can really, really help to modify gene activity in a healthy way, and that's called epigenetics. So that is the real promise of, functional medicine and lifestyle medicine is, can you change the gene so that you're more functional and not dysfunctional? And so your DNA is not your destiny. The DNA is kind of like the cards that are in your hand, but your lifestyle and your epigenetics and the way you interact with your environment is like the card game, is how you play the cards. So functional medicine is preventative, personalized, and precision medicine that is individualized based on your biochemistry. It does recognize the contribution of the socioeconomic and environmental, factors too, because all that affects the person's health individually. Community affects the individual. And it is a great operating system for chronic illness. Western medicine is great for acute illness. Functional medicine should be the operating system for chronic disease and health promotion. This is because medicine needs to be based on root cause physiology, where the body is connected and not siloed into different specialties only. And so we connect the biological systems in functional medicine, things like cardiovascular, gut, immune health, energy restoration, detoxification, hormone balance, structural health, brain health, and of course, mental, emotional, spiritual health and connections. And medical practitioners and healthcare practitioners of all different types can be trained in the lens of functional medicine, which is essentially the lens of taking a symptom or taking a diagnosis and understanding why, or asking the question, why did this happen? Why do I have these symptoms? And getting to the root cause. And if you want more information on functional medicine in terms of definitions and research and a lot of the exciting things that are happening, you can go to them.org to find out more. Conventional medicine and functional medicine synergize together. They reinforce each other. They're not mutually exclusive. Both are needed for optimal care. Conventional medicine is the medicine of what? If someone has a headache, I want to know if it's a migraine, a tension headache, or a cluster headache, and we can make that diagnosis. We can name the problem. We can kind of describe it. Functional medicine is the medicine of why. Why does someone have that headache? Is it a vitamin D deficiency? Is it a toxin? Is it a gut sensitivity? Is it chronic stress that's causing inflammation that's leading to insomnia that's then causing the headache? That is the root cause underneath the problem or symptom. The way I like to look at it is if your car had a headlight, or I mean, or a blinking light on, that light is a notification that something's wrong with the car, and then you have to look under the hood and see what's going wrong in this functional medicine to how to balance that out. So conventional medicine, typically we think about different silos of specialties like cardiology and gastroenterology, rheumatology, neurology, gynecology, but all these things are really just artificial silos. The body is actually truly connected in all those different areas, kind of like this holistic crystal here. And, the gut is connected to the brain, which is connected to the immune system, which is connected to circulation. And when you look at the body as a whole picture, you get a much more thorough and comprehensive, and I would argue, effective way to treat someone. So mapping the root causes, functional medicine, listening to the patient's story, identifying what are called antecedents, triggers, and mediators, basically predisposing factors, activators, and contributors to why that person developed illness or health conditions, identifying modifiable personal lifestyle factors, which are the bottom of that matrix, things like sleep, exercise, nutrition, stress, and relationships, and then assessing for environmental toxic exposure. That could be toxic chemicals, mold, heavy metals, environmental chemicals, stress, psychological stress, physical stress, toxic people, if there's unhealthy relationships. All these things can be toxins to that person's environment. And then organizing the person's clinical imbalance via an integrated biological, mental, emotional, spiritual model, which is in the center there. So the approach of functional medicine is really nice because we start really broad and fundamental with lifestyle because according to the World Health Organization, the major causes of chronic disease, things like heart disease, stroke, type 2 diabetes, dementia, gout, COPD, arthritis, all of those causes are known. And if the lifestyle factors were optimized and risk factors for the diseases were eliminated, then over 80% of all chronic disease and 40% of all cancer would be prevented using functional medicine. Some of the core clinical imbalances that we use in our clinic and that we teach medical students and we teach pre-meds and we kind of teach students that rotate through here as well are how do we approach a patient? How do we look at someone's health? And, how should you look at your health if you're looking at, well, where do I start? Where do I begin? You can look in these basically 9 areas, and, you can prioritize like where to start. You don't want to do necessarily everything at one time to be overwhelming, but kind of start in these 9 areas. So these 9 areas are assimilation, which is basically gut health, microbiome health. Second would be defense and repair, which is basically the immune system and how that interacts with inflammation and with chronic infections. Energy, which is basically booting up your energy to optimize your mitochondria, because the mitochondria are the batteries inside your cells that make ATP that keep you going and keep you thriving and not just surviving. Biotransformation and elimination is basically your detoxification system, anything from your liver detox to your skin to your lungs, your bladder, your colon, and that whole process of detoxification. Transport's going to be your cardiovascular system and your lymphatic system. Communication is hormones, neurotransmitters, cytokines, things like that. Structural integrity is both the musculoskeletal structure from joints, bones, and tendons to also some membranes. And then brain health, really important, brain health and nervous system health, I should say. And then also balance between the physical aspects, the systems biology, with also mental, emotional, and spiritual balance. And I would argue that that's actually the most important, because at the end of the day, if we are physically amazing and feel good that way, but we don't feel good mentally, emotionally, spiritually, that's going to be not a great quality of life at the end of the day. So all these things are really important. And going from imbalance to balance and from surviving to thriving, that's what we do here in functional medicine. So, just to kind of simplify it even more, because that was a lot right there, we can talk about if you have any chronic health condition, which we would define, WHO defines as anything, any persistent issue that you have over 6 months is chronic. Okay. So, top 5 causes of chronic illness, we're going to use a RCA root cause analysis to really get to the underlying, look under the hood of that car, look to see what's going on. There's really 5 things that we think about. Number one is we start in that first slide about starting with food and food as medicine. So the first thing is really to look at nutritional status. Poor nutrition and impaired gut health and impaired absorption will cause a lot of chronic disease and chronic illness. The second thing would be toxins, too much of things, substances that essentially damage the body, whether in too high of amounts or even some toxins damage the body in any amounts, things like heavy metals. So toxins would be another cause. Infections can be anything from Lyme or Epstein-Barr, chronic viruses, COVID and post-COVID. So infections can cause chronic illness too, because they trigger inflammation and basically a feeling of imbalance in the body. And then allergens would be another one. Allergens could be things like environmental allergens, food sensitivities, things like that. And then stress can be things like physical stress, um, trauma like, from a car accident or an accident, or it could be from playing football or something like that, getting a concussion, post-concussive syndrome. It could be psychological stress where someone has extreme anxiety or post-traumatic stress disorder. We're even seeing people now with medical trauma, which, they've gone through a conventional system, not feeling heard by doctors, and then they get stressed from that. So that's another cause, relationship stress, things like that. All these things can cause chronic illness. So getting through some of the case studies, I wanted to just mention a few things, and we can kind of go through, and then there's time for questions. But, these are kind of ways we would concretely, essentially manage and evaluate and manage and treat different chronic health conditions. So we have 5 cases, and I think, if anyone on here is a practitioner, I know we have a few practitioners on here, want to chime in, feel free to do that. Not to put you on the spot here, but and so case 1, we have cardiometabolic disease. We have case 2, irritable bowel syndrome. Case 3, autoimmunity. Case 4, chronic fatigue. Case 5, mild cognitive impairment. We have Dr. Claudia, naturopathic doctor on here, functional medicine trained, and Megan, our nurse practitioner here, functional medicine trained. So they can chime in. Just feel free to chime in. So one thing that we think about, even to simplify it further, this is a picture of wildfires in California, unfortunately. And basically, we know that wildfires, that means that you get this picture of inflammation, right? Right here, the trees are inflamed. When your body is inflamed, inflammation is the root cause of much chronic disease. It can lead to diabetes, cancer, cardiovascular disease, inflammation of the brain from Alzheimer's, Parkinson's, things like that, pulmonary disease, arthritis for joint issues, autoimmune diseases, which means the immune system attacks your own tissues and your own organs, and then other neurological diseases, things like MS or even ALS and things like that. So inflammation is really a driver, a big driver of chronic disease. Case one is heart and cardiometabolic. So this is a 55-year-old female executive with hypertension, elevated cholesterol, slightly overweight, and has prediabetes. What questions do we want to ask her? What connections do we make? What are some of the recommended diagnostic considerations? What are some of the potential treatment options? Maybe briefly, I don't know if Claudia or Megan, you want to volunteer, just jump in. If you want to take one of these, just to, since you're on here, it wasn't planned, but let's we can kind of go from there. But Claudia, I know you like cardiometabolic. If you want to
Yeah,
jump in, yeah.
right. I always start with the basis. So lifestyle, focusing on nutrition, sleep, exercise, stress levels, exposure to toxins also. So I would like to know all of those to see how can we support her in that sense. Definitely, diet is something to consider in patients with cardiometabolic diseases. As I said, stress, sleep, all of the lifestyle considerations should be taken into account.
Yes, thank you. And she might be traveling a lot. She might be under a lot of stress, might be overworking, undersleeping, right? So all those things would affect her
Mhm.
lifestyle. Is she exercising? Is she getting enough sleep? Is she eating the right foods? If she's traveling, how does she modify her diet? So we would definitely want to do, lab testing. We'd maybe do a sleep study to see if she has sleep apnea. We'd want to do an in-body body composition test, I think. We could treat her convention with metformin. We could definitely treat her with nutrition, lifestyle changes, exercise prescription. We could give her different nutraceuticals, things like that that would help with her metabolism.
Right.
Peptides, there's different things we could do. We would want to look at her hormone levels too, because sometimes hormones in a lady that may be postmenopausal at 55 would affect metabolism. So yeah, many different systems biology approach. So thank you. These are just like little vignettes. They're not meant to be like, we're not going to go through like the whole presentation on each one because we have five of these, but just kind of get an idea of what we would do here. This is a patient, they're leaning over, they're kind of bloated, maybe they ate some pizza or something with IBS. So another, a 35-year-old mom with bloating, anxiety, abdominal pain. She traveled to a different country and she felt ill after that. So, this has been going on for a while. She's already seen gastroenterology. They've done an endoscopy. They did a colonoscopy. They didn't find anything. We've done some lab work on here, things like blood counts and liver tests, kidney tests, and she's pretty frustrated, hasn't really found anything there. So I think I might call on Claudia again for this one since I know you're so into GI. But what are your thoughts on this one?
Yeah, I think that because it happened 3 years after she traveled, it's something to take into consideration. So you can do like stool testing to assess for any gastrointestinal changes in the microbiome. You can also do, depending on how are her stools, you can think about SIBO. I would like to know when does these symptoms happen, like the bloating and the abdominal pain, if it happens all the time or it's only after eating. Something to consider too. If she thinks it's related to her mental health as well, there's a strong brain health connection or mental health gut connection. So I would like to know if she thinks her anxiety exacerbates the bloating and the abdominal pain too. But yeah, stool testing is something to consider. Even with just having abdominal pain as an only symptom, you can do a panel to rule out IBD too, because not all patients have blood in the stools or diarrhea. So ruling out those big ones can be something to consider for sure.
Yes, thank you. And she is first of all a mom and she's anxious on the go a lot. Maybe her kids are 3 and 5 years old, they're young kids. She's
Mhm.
working, she's traveling, she's juggling a billion balls in the air. So she has some gut-brain disconnection from the anxiety and from running around a lot. And then I think the other thing, like you said, stool test, SIBO testing. Trying some things to kind of slow down her day to kind of help her digest more. Depending
Mm.
on what's going on, we could treat with SIBO with antibiotics or herbals, different things to help reduce some of the overgrowth of the microbiome. If it's too much of an overgrowth of different inflammatory bacteria, we can definitely treat with nutritional changes in specific diets and things like that. That would help. And then there's also different apps. There's one that we like called Nerva, which is NERVA, which is a hypnosis, research-based hypnosis that helps to treat IBS, if someone has a gut-brain disconnection. But a lot of different biological causes of irritable bowel syndrome. So it's really a label. And like Dr. Claudia said, I think it has to be differentiated from inflammatory bowel disease, which is more of an autoimmune condition. And that can be done with both blood tests and things like colonoscopy, which she already had. So yeah, just kind of taking that a step further, getting to some of these root causes and stool testing that we do are not the same as a conventional lab for stool tests. We use a lot of high level DNA testing and other things that would tell us a lot more. So yeah,
Yeah,
gut's always a big
that's
one.
a good point, Dr. Wong. I think the testing that we do is very different from traditional. They're, of course, going to scope, which I think is great to kind of rule out things like IBD, but the stool testing that we do is different. We also are looking further at, someone with long-standing irritable bowel syndrome may have a lot of inflammation and micronutrient deficiencies, so we're assessing for all of those as well.
Yes, agree. Thank you, Megan. And yeah, I think it basically just to let everyone know on the listening to this, it's not the same type of stool test. So it would certainly be helpful to know about, different functional testing options that would actually give a lot better answers, I think more accurate answers than a lot of things that have been done conventionally. So thank you, Megan. And then definitely, thank you, Jean, for the comment. We'll talk about that in a minute. This is a 45-year-old case three, a 45-year-old with joint pain. She has antibodies like CCP antibodies are associated with rheumatoid arthritis, and then she has some thyroid antibodies associated with an autoimmune condition called Hashimoto's, also called autoimmune thyroiditis. So she has two autoimmune conditions that are affecting joints. They're also affecting just generally her body with hair loss, fatigue, constipation, irregular periods. Those are usually signs of Hashimoto's or autoimmune thyroid. So, what questions would you ask, or what connections would you make? What are some potential diagnosis and treatment? Megan, if you want to volunteer
Yeah,
for this, or yeah, thank you.
a lot of times with our, our females or even just autoimmunity in and of itself, we're kind of starting in the gut. How's the gut going? How's their gut health? A lot of times there's additional sort of food sensitivities and what we call leaky gut syndrome, which is where it sort of heightens the autoimmune response. So starting with the gut would be helpful, but again, with autoimmune conditions, you want to really assess lifestyle. How are they sleeping? How is their stress level? What does their nutrition look like? Is it promoting more inflammation with the diet that they're eating daily? So those are some of the things we need to think about with our autoimmune patients.
Thank you, Megan. Yeah, definitely start with the gut. There's that gut immune connection with 70-80% of the immune cells that are made in the bone marrow and thymus actually ending up in the gut because the gut is basically the main interface between the outside and inside the body. And a lot of those cells are going to stay there in the gut, B cells, T cells, certain type of white blood cells called mast cells, and like all this stuff that some people might have heard of. The other issue is that sometimes we'll see infections, things like Epstein-Barr is associated with both rheumatoid arthritis and Hashimoto. So some infections can trigger the immune system to attack, someone's own tissues via something called molecular mimicry, where there's some proteins that are found in viruses that look like some of the body parts or body tissues. So then the immune system attacks the body tissues because it thinks it's a viral particle. So there's different things. Yeah, treatment could also be related to, let's say this person's on some thyroid medication. A lot of times we have to look at different lab tests like free T4 or free T3 to make sure that they're optimal on the thyroid medication because sometimes it's sort of undertreated there. So definitely a lot to go along with autoimmunity. Thank you, everyone. So this is a little bit younger patient. This is a patient with chronic fatigue, 24-year-old medical student, and she has had fatigue for 10 years, which is a fairly long time for a 24-year-old, which has affected her ability to socialize, study, and live life. Um, I'll kind of take this one because I tend to like to see patients with chronic fatigue and energy issues. But you want to ask her about depression and make sure she doesn't have suicidal ideation, things like that. What has she tried before? Chronic fatigue is usually a sign that the mitochondria are not working that well, the batteries are not rebooted as much. What is going on with, her periods? Does she have heavy periods that's causing low iron that might be causing chronic fatigue? What's her thyroid like? And definitely checking her lab tests for hormone balance, for vitamin levels, liver, kidney, all the usual things, blood counts. But also, when did it start? Did she have a normal childhood, so to speak, normal energy, and then all of a sudden it started really quickly? Then you'd have to think about an environmental exposure acutely. Sometimes gradually, environmental exposure could be from things like mold or toxic mycotoxins. It could be from Lyme disease or co-infections, and someone with a tick bite could have fatigue over a period of time. And that might not be easy to diagnose or to evaluate and detect. And it certainly could be certain things that Gene put in here, like, too much time on the screen, not enough time outdoors, not bringing in the joy and the endorphin kind of pieces in there, watching the news too much, being on her cell phone too much, is she getting, just go back to the basics, is she getting exercise? How's her sleep? What's her nutrition like? What's her gut like? So th this is a very broad case, and making those connections are really, really important. If she had depression or if she had some sort of mood aspect to the fatigue, then you have to look at what's her brainwave function like. Does she have a low frontal alpha, which would be more consistent with depression? We could check her quantitative EEG that we have our assistant here do, Callie. And so the idea is you could have many things causing fatigue, and I think we have to just systematically look at each thing before we figure out diagnosis and treatment. There are ways to treat this, and there's ways to make people feel better with even like the IV therapy that we have, your IV nutrients, IV ozone, different vitamins, different things. So, really getting to treating symptoms and also addressing the root cause to reboot the mitochondria. And then finally, we have a case 5, which is a 66-year-old retired female teacher with mild cognitive impairment. She has symptoms of increasing word difficulty. How many people have memory issues? Sometimes it's like, do I remember some things? But short-term recall problems and trouble driving to places. I sometimes have trouble at social events with like names, that's just a personal thing. It takes me a while to remember people's names. So just in case I forget someone's name, it's not a personal thing at all. Um, so what questions do you ask this teacher that has potentially signs of cognitive impairment? Maybe when did it start? What are some other symptoms she might be having? How's her gut? How's her sleep? How's her lifestyle? Has she had a tick bite? Has she had any sort of infections? What's her environment like? Uh, yeah, Megan or Claudia, any other thoughts on these things? But another very common type of presentation that we see in functional medicine, and certainly we have a lot of diagnostic and treatment options for that too. I would say we want to look a little bit more at, a systems approach with the brain. Usually there's multiple inputs. So thinking of what are triggers of inflammation, what's her circulation like? Is she getting enough oxygenation? Is she getting enough nutrition? What's her hormone balance like? Low hormones will also cause cognitive impairment. And then, does she have time to repair, restore, regenerate her system? What's her stem cell quality like? Usually at age 30, that's when stem cell regeneration starts to go down. So there's a lot of different things that can be done to help reboot someone's brain. It becomes a little not complicated, but just, there's just a lot of steps involved. So definitely something we also specialize in. And it's just a definite, take some time just to kind of take each piece, step by step. Um, so basically, functional medicine, as you see, through these five cases is root cause resolution medicine, looking at environmental inputs, looking at different lifestyle factors, looking at mind and spirit, genetic predisposition, experiences, attitudes, beliefs, looking at fundamental physiologic processes, which is where systems biology comes in, and then kind of further up the tree, clinical imbalances, identifying those, treating those, and then looking at quote unquote symptoms in terms of specialties, but ultimately taking all that and hopefully seeing someone get better over time as the root cause is addressed and treated. I'm not going to go through the slide because it's kind of complicated and not as helpful as I often think it would be. But this is just like some ideas of like conventional versus integrative versus functional. So just some ideas about how to look at it. Functional medicine, we do like testing. We don't have to test. We can treat empirically. But we do want to start with diet and lifestyle and organize the clinical imbalances, often the gut first. It is data driven. We use advanced molecular and biochemical tests to track, assess, look at interventions, and then follow up and reassess to see what is happening with clinical outcomes. These are just some ideas, and some of these tests. Just to give you some idea, we do comprehensive stool testing here. We'll do hormone and metabolite testing that looks at hormone balance and metabolism. We look at intracellular micronutrient testing. These are just some slides that kind of show pictorially what you might see, when you do functional testing. Some ideas here about sample treatments using a combined approach of more traditional medicine versus integrative and functional. And you can see that synergistic, it's not competitive really. It's more just like how do you align and map out everything and combine everything so that you get the results that you want essentially. So this is kind of those five cases here, and we'll send you the slides if you want. We can do from there. At functional medicine is becoming increasingly evidence-based. I think there's more that's needed in terms of the research space. I know that one of the goals of CAH is to eventually establish a 501(c)(3) that would have both the ability to care for the underserved and care for those that can't afford functional medicine, but also to promote research and promote data that would drive the field forward in a very solid way of, things that are working, things that aren't working, things like that, so that we can start to establish more streamlined protocols so that we can help more people and kind of get the data out there for the benefit of both clinicians and patients, for our whole society, because we do want to get, root cause medicine out there for everyone. Cleveland Clinic opened in 2014. It was the first academic medical center to embrace functional medicine. They have doctors, they have nurse practitioners, PAs, dietitians, health coaches, and their investigative researchers are testing the functional medicine model against various conventional protocols using, I think they're studying inflammatory bowel disease, asthma, migraines, different things. Or they're measuring across a variety of clinical measures such as quality of life, clinical outcomes, and cost measures as well. True evidence-based medicine is a combination of patient values, the best evidence available, and clinician judgment. And that is really truly what will move the needle on your health. So you can kind of see, not having a narrow, okay, it's just based on evidence only, often driven by pharmaceutical companies, but it should be whatever the best available evidence, clinical judgment, and patient values, and co-creating a shared decision making. For your treatment, this is kind of a busy slide, but just how we kind of treat people here at our clinic here, basically performing an intake assessment and plan, co-creating that treatment with the team, using a team approach, using what you desire as a patient and what you can reliably do, and then tracking results either with clinical symptoms, findings, or labs. And then if you're getting results, great, consider some check-ins and maintenance and kind of readdress some of these longer term things that would help with maintenance of health. If not, then these are the questions. I got this from Dr. Anderson, Paul Anderson, is one of our mentors. But if the results are not, happening for you and you're not getting the results you want, do you just need more time for the treatment? Is the treatment underdosed or overdosed? Are there different orders of operation that we might have to do? We might have to treat the gut before detox or vice versa or something. Was our assessment or diagnosis not correct? Maybe we need to realign with, a patient's needs and goals, and we just were off base on that. Is there some other cultural or other difference that we're not aware of that might be impacting that person's health, whether cultural difference, socioeconomic, challenges or relationship issues that are going on that we're not aware of. So any of that could be a factor there. The challenges for functional medicine moving forward, I think we need to keep defining major root causes. We need to relate how we can integrate with, integrative and conventional medicine. We need to establish what works, establishing more research, building the evidence base, and then we need to address the issues of affordability, access, community, environmental justice, which applies the promise of integrative and functional health to community and population health and bring it out there to as many people as possible because we really believe that everyone deserves this type of medicine. It shouldn't just be for people that can afford it. There's been, some financial reimbursement challenges and things like that, which, I think makes it harder. But ultimately, that's what we want to bring out this education to everyone. So I'm teaching some of the Georgetown pre-med students the integrative healthcare track students, like Callie here, so I'm here, and then also Georgetown School of Medicine. We've had previously naturopathic medical residents like Dr. Claudia, who's now full ND, or we've had nurse practitioner students here. We've had a lot of different people run through here, and then just keep on going to conferences and offering electives. Emphasis in functional medicine should really be on preventative disciplines and primary care, but also the specialties. Any doctor practitioner can really practice functional medicine. It's just a lens that we do. Everyone is potentially a coach, and we have a health and wellness coach here now. But I think the reason I'm mentioning that is because, if you have a friend or a family member, you could be accountable to them or push them. So we want to have health evolve in communities, and we definitely will offer our health and wellness coach here, Telka, as a partner with you too. Group visits is something that if you're interested, we could definitely offer again down the line. Medical, mental health, even wellness group visits, ways to kind of reform healthcare. And then I think this is a big factor that is not well talked about. A lot of times is it's not just about individual health, it's about environmental health. Things like increasing public awareness of toxic chemicals, the importance of access to food. So we eliminate food deserts, we get more clean air and water, we spend more time outdoors, that we have green spaces to play in and work in, and then combating social isolation through creation of community and communities so that, these are all really, really big drivers of health, not just individual health, but community and environmental health is going to drive individual health too. So a bunch of people holding some soil at the plant here. Relationship is a key to healing. This is a reboot of a kickoff of Thriving Thursday. So, I want to establish relationship with everyone listening here. Thank you for listening to this. Relationship with yourself, others, patients, with nature, relationship between the environment, different biological systems, and the health of the environment, like I said, will impact the health of the individual. So we want to co-create this webinar, whether you're listening via recording or whether you're listening live. Thank you for those who are listening live. Definitely, we want to establish that relationship or what else you want to see next week or the week after, because this is an ongoing education so that we can all heal together. And with that, I want to thank you. This is our Instagram, Facebook. We have a text messaging service now, which is nice, 240-213-7900. Love to hear from you. We do offer free 15-minute consults. I know that Megan and Dr. Claudia offer these two free 15-minute consults so you can talk to them about your health and your health issues and kind of how to approach it in a root cause way. So I'm going to stop this share. I'm going to stop the recording, but thank you all for listening, and we'll see you next time. See. Is Callie there? Can you? Oh, here we go.